In this podcast episode, Mel Robbins welcomes Dr. Aditi Nerurkar, a renowned expert in stress management and public health. The conversation delves into the pervasive issues of stress, loneliness, and the unique challenges faced by parents and caregivers. Dr. Nerurkar shares her insights on the biological underpinnings of stress, the impact of loneliness on health, and practical strategies for managing these challenges. Robbins begins the discussion by highlighting the alarming statistics surrounding stress, noting that approximately 70% of people in the U.S. are struggling with it. Dr. Nerurkar explains that stress is not merely a feeling, but a physiological response that occurs when the brain's prefrontal cortex, the area responsible for rational thinking, shuts down, and the amygdala, which governs survival instincts, takes over. This shift can lead to a chronic state of stress, where individuals feel overwhelmed and unable to think clearly. Dr. Nerurkar introduces the concept of horizonless, a term that describes the feeling of having no clear future or direction. This phenomenon has become increasingly common, particularly in the wake of the pandemic, as many people find themselves unable to anticipate positive outcomes or look forward to future events. The lack of hope can exacerbate feelings of stress and anxiety, creating a cycle that is difficult to break. The conversation shifts to the topic of loneliness, which Dr. Nerurkar describes as a global epidemic. She cites data indicating that 330 million people worldwide go weeks without speaking to a friend or family member, and loneliness has been linked to severe health risks, comparable to smoking 15 cigarettes a day. The Surgeon General has labeled loneliness as an urgent public health crisis, particularly affecting younger generations, with 78% of Gen Z reporting feelings of loneliness. Dr. Nerurkar emphasizes the distinction between being alone and feeling lonely. While being alone is a physical state, loneliness is an emotional experience that can occur even in crowded settings. She explains that casual conversations with acquaintances, what she refers to as weak ties, can significantly alleviate feelings of loneliness. Engaging in brief interactions with others can foster a sense of community and connection, which is crucial for mental well-being. The discussion also addresses the unique stressors faced by parents and caregivers. Dr. Nerurkar shares findings from the Surgeon General's report, revealing that nearly 50% of parents feel overwhelmed by stress on most days, with even higher rates of loneliness among single parents. She stresses the importance of self-care for caregivers, noting that parental stress can have lasting effects on children's health and well-being. Dr. Nerurkar advocates for a cognitive shift in how parents view their responsibilities. She encourages parents to set boundaries for themselves, just as they do for their children. By prioritizing self-care, such as getting adequate sleep, engaging in physical activity, and fostering social connections, parents can better manage stress and model healthy behaviors for their children. Throughout the episode, Dr. Nerurkar provides actionable strategies for listeners to manage their stress and anxiety. She emphasizes the importance of normalizing and validating feelings of stress, reminding listeners that they are not alone in their experiences. Self-compassion is a key theme, as Dr. Nerurkar encourages individuals to be gentle with themselves during difficult times. One of the most significant takeaways from the conversation is the idea of agency. Dr. Nerurkar explains that taking small, manageable actions, such as going for a walk, prioritizing sleep, or engaging in casual conversations, can help individuals regain a sense of control over their lives. These actions can shift potential energy into kinetic energy, fostering a sense of accomplishment and motivation.